From blank sheet to fully operational hospital in less than a fortnight. A 21st century global pandemic requires an unprecedented response, and the NHS Nightingale is just that.
We take our resources from NHS London and we want to be coordinated from the centre so that they know the best places to deploy staff and deploy resources. At that point, we'll be ready to receive the equipment, the staff and then the patients at scale and at pace at the same standard as occurring back in the NHS.
The language used by the Prime Minister and his aides is martial. Talk of battle lines being drawn. So it's right the military was asked to deliver this logistical and engineering masterclass. Skills honed on the battlefields of Afghanistan, deployed to the front line in East London.
It's an unseen enemy. It's still a battle, and it's still timelines that you're working to, and it's always trying to get ahead of the picture. You're trying to get ahead of the enemy, and in this case, you're trying to get ahead of a virus. And so the whole idea about building at scale and pace is to build a really fantastic facility that delivers safe patient care at scale and keeping ahead of the battle, keeping ahead of the virus.
The sheer scale of this project and the speed at which it was delivered is breathtaking. These aren't just partitioned beds. The NHS Nightingale is the world's largest critical care unit, fully equipped to deal exclusively with very sick COVID-19 patients. And these ventilators, in short supply nationwide, will soon be plumbed into a 4-mile-long oxygen tube network.
You can't help but be struck by the sheer enormity of this project. This corridor is a kilometre long. That's row after row after row of critical care bed capacity. And that gives you an idea of the challenge facing this country.
Retired medics, airline staff and an army of volunteers will be the lifeblood of this hospital. Trained critical care doctors and nurses will be sent here from other London hospitals too. They will need the same safety assurances as their worried colleagues elsewhere in the country.
We've sent out over 750 million pieces of protective equipment over this last fortnight, and we're needing to do more. We absolutely need to make sure our nurses and midwives, our staff on the front line, have the protection.
The Nightingale is ready to treat its first COVID-19 patient. That is no cause for celebration, but it will be when she treats her last. Ashish Joshi, Sky News.